Did you know the biggest threat to your heart health might actually be hiding right under your nose, literally? We often think of heart health as just diet and exercise, but there is a silent alarm going off in your mouth right now that predicts cardiovascular risk, and you probably ignore it every morning. It is not just about having a bright smile or fresh breath. We are connecting the dots between your gums and your longevity using data that connects oral health directly to your circulatory system. We aren't just talking about cavities today. We will explain how oral bacteria travels through your bloodstream, the specific signs of periodontal heart risk you can check in the mirror right now, and the simple 2-minute nightly routine that protects your smile and your ticker. Let's get vital. Think about the last time you washed your hands. You probably did it to get rid of germs so you wouldn't get sick. Now think about your mouth. It is warm, it is wet, and it is the perfect environment for bacteria to thrive. Most of these bacteria are harmless, but some are not. When your gums are healthy, they act like a tight seal around your teeth, keeping those bacteria where they belong. But when that seal breaks down, even a little bit, it opens a door. It is like having an open wound on your skin that you dip into a bacteria-filled solution every single day. If you had a cut on your arm the size of your palm that was infected and bleeding, you would run to the emergency room. Yet, if you took all the infected gum tissue in a person with moderate gum disease and laid it out flat, it would be roughly the size of the palm of your hand. We ignore it because it is hidden inside, but your heart certainly notices. This connection matters more now than it did 20 years ago. As we enter our 50s and 60s, our immune system naturally changes. It becomes a little less efficient at fighting off low-grade infections. Simultaneously, years of wear and tear on our teeth can create rough spots and pockets where bacteria can hide. This combination creates a perfect storm for inflammation. Inflammation is the body's fire alarm. When your gums are inflamed, your body pumps out defense chemicals to fight the infection. These chemicals don't just stay in your mouth. They travel. They move through your bloodstream and can contribute to the hardening of the arteries. This is why researchers have found such a strong association between gum disease and heart disease. It is a two-way street where treating one helps the other. If you are finding this connection surprising, or if you want to make sure you are getting the most practical, research-backed tips for your health as you age, go ahead and click the subscribe button. We focus on simple, clear steps for vitality that respect your time and your intelligence. Joining us helps us keep bringing you these deep dives into the hidden aspects of your health. Let's talk about the specific mechanism happening in your body. It is fascinating and a little frightening. There is a specific type of plaque that builds up on your teeth. We call it dental plaque. There is also a type of plaque that builds up in your arteries, leading to atherosclerosis. While they are different substances, the bacteria from your mouth have been found inside the plaque in clogged arteries. That is the smoking gun. It suggests that these microscopic invaders are hitching a ride from your gum line directly to your heart valves and blood vessels. When they arrive, they cause irritation. Your body responds with swelling. In an artery, swelling means the path for blood gets narrower, which raises your blood pressure and forces your heart to work harder. So, how do you know if this is happening to you? You might think pain would be the first sign, but gum disease is often silent until it is advanced. The real sign is color and texture. Go to a mirror with good light. Look at where your tooth meets the gum. Healthy gums are firm and pale pink. If you see red, puffy, or shiny tissue, that is the first sign of trouble. This is gingivitis, the early stage of gum disease. It is completely reversible, but it is the warning shot. The second sign is something many people accept as normal, but it is definitely not. If you see pink in the sink when you spit out your toothpaste, or if you taste a little blood when you floss, that is an active infection. Healthy tissue does not bleed when you touch it. Imagine if your scalp bled every time you brushed your hair. You would be worried. We need to treat bleeding gums with the same urgency. Here is a question to ask yourself right now. When was the last time you flossed and the floss smelled bad? That odor is caused by volatile sulfur compounds produced by bacteria feasting on leftover food and tissue. If you smell it, that bacteria is present in high numbers. This bacterial load is what we need to reduce to lower the inflammatory burden on your heart. It is not about sterilizing your mouth, which is impossible and unhealthy. It is about balance. We want to disrupt the colonies of bad bacteria so your immune system doesn't have to work overtime. This brings us to the tools you are using. A lot of us are using the same brushing technique we learned when we were 6 years old. We scrub back and forth, sawing at our teeth like we are trying to cut down a tree, and this is actually counterproductive. It can cause your gums to recede, exposing the roots of your teeth, which are sensitive and prone to decay. But worse, it doesn't actually clean the gum line effectively. The bacteria that threaten your heart live in the sulca, the tiny little ditch between your tooth and your gum. And to clean it, you need to angle your brush. Picture your toothbrush bristles. Tilt the brush at a 45-degree angle towards your gums. You want the bristles to gently slide under the gum line. Then vibrate the brush back and forth slightly. You aren't scrubbing, you are massaging. This motion disrupts the bacterial colonies hiding in that pocket. If you are using a manual brush, you have to provide this vibration yourself. This is where an electric toothbrush can be a game changer for adults over 55. It does the vibrating for you. All you have to do is hold it at the right angle and guide it along. Many models have pressure sensors that alert you if you are pushing too hard. If you have arthritis or limited dexterity in your hand, an electric brush acts like a power tool, doing the heavy lifting so you don't have to struggle. However, brushing only cleans about 60% of your tooth surfaces. The other 40% is where the real danger lies. The tight spaces between your teeth are safe harbors for bacteria. They can breed there undisturbed for weeks if you don't clear them out. This is where the connection to heart health is strongest, because the tissue between your teeth is the most vascular and most prone to bleeding. If you hate flossing, you are not alone. As we age, spaces between our teeth often get a little larger due to natural gum settling. String floss might not be the best tool anymore. It can be thin and ineffective at grabbing the gunk in wider spaces. Let me introduce you to the interdental brush. These look like tiny little pine trees or bottle brushes. They come in different sizes to fit different gaps. You simply slide them in and out between your teeth. They are easier to hold than floss. They massage the gums, and they are incredibly effective at removing plaque. For many people, switching from string floss to interdental brushes is the moment their gum health turns around. You can actually see what you are removing, which is satisfying and motivating. If you have a bridge or implants, these brushes are essential. They can navigate around the hardware in your mouth much better than string can. There is another hidden factor in the mouth-heart connection that almost nobody talks about. It involves your saliva and mouthwash. Your body has a miraculous way of regulating blood pressure using nitrates found in vegetables like spinach and beets. But your body can't convert these nitrates into nitric oxide, which relaxes your blood vessels without the help of good bacteria on your tongue. If you use a strong antiseptic mouthwash that contains alcohol or harsh chemicals every single morning, you might be killing the good guys along with the bad. Studies have shown that overuse of antiseptic mouthwash can actually raise blood pressure in some people because it disrupts this nitric oxide pathway. This is a perfect example of why balance matters more than sterilization. Unless your dentist has prescribed a specific rinse for a short-term infection, you are often better off sticking to water or a gentle pH-balanced rinse that supports your oral microbiome rather than nuking it. We promised you a simple 2-minute nightly routine that protects your heart. Here is exactly what it looks like. Do this before bed because saliva flow drops while you sleep, making your teeth more vulnerable at night. Step 1 is to clean between the teeth first. Use your interdental brush or water flosser before you brush. This dislodges the debris so the fluoride from your toothpaste can actually reach the enamel between your teeth. Step 2 is the brushing. Use a soft, bristled brush. Spend 30 seconds on each quadrant of your mouth: upper right, upper left, lower right, lower left. Remember that 45-degree angle towards the gums. Step 3 is the spit. Don't rinse. Rule: after you brush, spit out the excess toothpaste, but do not rinse your mouth with water. Leave that little bit of fluoride coating on your teeth to repair your enamel while you sleep. It feels strange at first, but it is the gold standard for cavity prevention. Some of you might be thinking, I have full dentures, so I don't need to worry about this. That is a dangerous misconception. Even without teeth, you still have gums and soft tissue. You can still develop stomatitis or fungal infections under your dentures. These infections cause inflammation, which we know is bad for the heart. You should still be brushing your gums, tongue, and the roof of your mouth with a soft brush every day to stimulate circulation and remove bacteria. And you absolutely must take your dentures out at night to let your gum tissue breathe. Keeping them in 24 hours a day is like wearing wet socks for a week straight. The skin will eventually break down. Others might be dealing with medication side effects. Hundreds of common medications for blood pressure, anxiety, and pain have dry mouth as a side effect. Saliva is your mouth's natural detergent. It washes away food and neutralizes acid. When you don't have enough of it, plaque builds up faster and gum disease accelerates. If you have dry mouth, you are at higher risk for heart issues simply because the bacterial load in your mouth is likely higher. You need to be sipping water throughout the day and perhaps using a moisturizing gel specifically designed for dry mouth. Avoid sucking on sugary candies to moisten your mouth, as that just feeds the bacteria. Look for products containing xylitol, a natural sweetener that actually inhibits bacterial growth. It is easy to feel overwhelmed by all the health advice out there. Eat this, don't eat that. Take 10,000 steps, sleep 8 hours. It can feel like a full-time job. But oral hygiene is different. It is a small, contained task with immediate feedback. You can feel the difference between a clean mouth and a fuzzy one instantly. By taking control of this small area of your body, you are exerting a positive influence on your entire systemic health. You are reducing the inflammatory load your heart has to deal with every single day. Let's address the fear of the dentist. For many in our generation, dentistry in the past was not exactly gentle. It was often painful and purely reactive. You only went when something hurt. But modern dentistry is focused on prevention and comfort. If you have been avoiding the dentist because you are afraid of what they will find, know that they have seen it all. They are not there to judge you. They are there to help you stabilize your health. If you have gum disease, there are non-surgical treatments now, like deep cleanings and laser therapy, that are much less invasive than the surgeries of the past. Getting that professional cleaning is like hitting the reset button for your mouth. It removes the hardened tartar that your toothbrush can't budge, giving your gums a chance to heal and reattach. Think of your gums as the soil and your teeth as the trees. If the soil erodes, the trees fall, no matter how strong the trunk is. But unlike soil in nature, you can rebuild the health of your gum tissue. You can stop the bleeding. You can firm up the soil. When you do, you are doing more than saving your smile. You are closing the door on bacteria that want to travel to your heart. You are lowering your body's overall inflammation. You are taking a proactive step towards seeing your grandchildren graduate, taking that anniversary trip, and enjoying your meals without pain. Here is a practical experiment you can try tonight. When you are doing your routine, time yourself. It really does only take 2 to 3 minutes. Contrast that with the time it takes to manage heart disease. The return on investment for these 2 minutes is massive. If you struggle to stand at the sink for that long due to back or leg pain, bring a stool into the bathroom. Sit down. There is no rule that says you have to stand up to brush your teeth. Make the environment work for you. If the handle of your toothbrush is too thin and hard to grip, wrap a washcloth around it, or slide a piece of foam tubing over it. Adaptation is the key to consistency, and consistency is the key to results. We have covered the biology of inflammation, the importance of cleaning between the teeth, the dangers of dry mouth, and the simple routine changes that make a difference. Now it is up to you to look in the mirror and see not just teeth, but a vital part of your cardiovascular system. If you found this information helpful and want to support your health journey with more evidence-based practical guides, please like this video. It helps other people find this life-saving information. And don't forget to subscribe to Silver Smile and Bites. We are here to help you navigate your best years with confidence and clarity. Your smile is the gateway to your health, so keep it strong, keep it clean, and keep smiling. We will see you in the next video.